Now let's discuss about the surface marking of the heart. This heart can be marked on the surface of the chest, which represent the heart inside, with four important points: point A, B, C, and D. Okay, so the first point, or the point A, will be marked at the upper border of the right costal cartilage, the third right costal cartilage. So this is the right costal cartilage. How do you know? So count from either from the clavicle. This is the clavicle here, the first, second, and third, or usually we take it from the sternal angle, which is the junction between the manubrium sternum and the body of the sternum. Here this is called as the angulation, which is called as the sternal angle, and just beside that will be the second costal cartilage. Below that will be the third costal cartilage. So this is the third costal cartilage. Mark a point at the upper border of the right costal cartilage. This is the upper border of the right costal cartilage. This is the upper border, and almost 1 centimeters from the sternal margin. So this is the sternum and this is the sternal margin, just 1 centimeter from the sternal margin at the upper border of the right costal cartilage. This will be the first point. The second point, again on the right side, go to the sixth costal cartilage. Again count from the second, third, fourth, fifth, and the sixth. By applying pressure, you can feel the sixth costal cartilage, and almost 1 centimeters again from the sternal margin, again on the sixth costal cartilage, you can mark the second point here. The third point you will take from the lower border of the second left costal cartilage, the left second costal cartilage. From there, almost 1 centimeters from the sternal margin, at the mark at the lower border of the second costal cartilage. This was at the upper border of the third costal cartilage. This is at the lower border of the left costal cartilage. So it becomes an angle. Okay, and now the fourth point will be at the apex beat, almost in the fifth left intercostal space below the fifth rib. Again, you count from second, third, fourth, and fifth costal cartilage. Below, between the fifth and the sixth costal cartilage and the rib, will be the fifth intercostal space. So mark a point in the middle of the fifth left intercostal space, just medial to the mid clavicular line. What is mid clavicular line? Draw a line from the middle of the clavicle vertically downwards. That will be called as the mid clavicular line. It is just medial to the mid clavicular line. So this point also represents the apex beat, the point of the apex beat, or the presence of the apex of the heart. So mark at this point. This will be the fourth point. So now join all these 4 points between the A and B with a small bulge from A to B, then A to C with a vertical almost oblique line from A to C, because this is in the second intercostal space, this is in the third costal cartilage. So slightly oblique line. Then mark join the C and D by giving a small bulge towards the left side, and now the join the B and D. So this represent the surface marking of the heart. So when you join A, B, C, and D, then it becomes the surface marking of the heart, which represent the heart inside of any human. Now there are some important points where you can auscultate for the different structures of the heart, especially if you see here. So here at the uh, uh, second intercostal space, so just below the second costal cartilage, in the second intercostal space on the right side, just lateral to the sternum, you can auscultate. If you put the stethoscope here like this, and then you can auscultate the aortic valve, because the aorta is very close to it. And if you put the stethoscope on directly on the sternum, because it is behind the sternum, you cannot auscultate. So just lateral to the border of the sternum, if you put in the second intercostal space, then you can auscultate the aortic valve sounds. If you want to auscultate the tricuspid valve, then you will go towards the fifth intercostal space. So this is the second, this is the first, second, third, and fourth, and this is the fifth. On the again lateral to the left border of the sternum, put the stethoscope there like this, and then you can auscultate the tricuspid valve, because again tricuspid valve is between the right atrium and the ventricle, and this junction is again behind the sternum. So if you approach slightly towards the left side of the sternum, then you can, in the fifth intercostal space, then you can auscultate the tricuspid valve. If you want to auscultate the mitral valve, then you have to go slightly below in this fifth intercostal space towards the apex beat, which is just medial to the mid clavicular line, vertically drawn from the clavicle downwards. And if you approach the fifth intercostal space, just medial to that will be the apex beat. So if you put the stethoscope at this apex, then you can auscultate the mitral valve. And if you want to auscultate the pulmonary valve, then go towards, instead of the right side you had gone to auscultate the aortic valve, just go on the left side in the second intercostal space, just lateral to the left margin of the sternum, then you can auscultate the pulmonary valve, because the pulmonary trunk is on the slightly towards the left side and the aorta is slightly on the right side. So these are some important positions where you can auscultate the four valves: the aortic valve, the pulmonary valve, the tricuspid, as well as the mitral valve.